welcome back to OT in the Real World. I'm Lauren, an OTA, and this is Kim, an OTR. And today we're going to be discussing more advanced techniques for children that are really adverse to teeth brushing. And don't mind the wrinkles on my shirt or my face. Kim?
Great. So yeah, if your child has really been struggling with toothbrushing and they're having a lot of issues in that area, I'm going to give you my advice. And again, I'm an OT and I'm also a BCBA. So this is kind of coming from both angles here. But as we talked about last time, you want your child to be well anchored. So sitting firmly, if you need to put them in a chair, anything to get them firmly planted and anchored somewhere. And then you want a mirror in front of them so they can see everything that's happening. They may require a little more support from you. So one way I've done this in the past is you're going to take your fingers like this and you're going to make sort of a little support system for her mouth and jaw. Actually, right now I'm going to go down here and then I would have her open and then I would do all the things that I've talked about before. So I'm going to brush right here, 1, 2, 3, and then you let go and give them a little relief. And each time you're going to want to set just a small goal. So maybe you're only toothbrushing in one area, then maybe you increase it to 3, then you know, every area that you want to get to. But you need to go systematically in small increments. I forgot to talk about, before you even sit down to do this, you can do some of your heavy work or some of your other regulation type activities. And then there may be some sensitivity in the face, right? So some things to help desensitize. I didn't have a face washcloth on me, but you could use a washcloth instead of your hands near the child's face, so you're not putting that tactile pressure on them. It's a little more neutral. You can also do some kind of facial massage. So you're going to start from here, and I would do a firm stroke down toward the mouth on each side. I might go 1, 2, 3, 1, 2, 3, and then I would do the upper lip down under the nose to the top lip, and then the chin to the bottom lip.
Only one of the chins.
I would so these are things that I would do to prepare for toothbrushing. If your child is really averse, you're not even going to use the toothbrush yet. Maybe you're just going to do the facial massage and then you're just going to let her hold the toothbrush the whole time. Maybe you're going to start before you do the toothbrushing with touching the face with the toothbrush. So I'm going to be like, okay, I'm going to touch here, 1, 2, 3, and then I'm going to touch here, 1, 2, 3. That way you're making the toothbrush not such an averse stimuli to the child. I worked with a family that did something like this for preparing to go to the dentist, where for weeks in advance, the child would sit in the chair and the parent would take kind of a metal looking instrument similar to a dentist tool and just tap, and they would count to 10 in each area of the mouth, and even like open the mouth and go inside a little bit, just to prepare the child for that stimuli coming, because half of this just comes from the fear of the unknown and the unfamiliarity of what's happening. So those are some more tips for the more intense situations with toothbrushing.
All right, and don't forget to hit like and subscribe, and we'll see you guys next time. Thanks again.